I want to weigh in about Ozempic. Yes, I know that it seems to work for the short term at helping people lose weight, especially diabetics, but it's the wrong way to go for several reasons. Number one, it seems people gain the weight back in the long run. Number two, it tends to deaden their appetites for other things like sex and the enjoyment of life. But number three, it gives permission for people to continue to go through the drive-through and order the Big Mac instead of doing what we really know that drives longevity, which is cooking at home, eating with your family, eating mostly whole food, plant-based, and moving naturally. That's what has worked for millennia. That's what's going to work for the human machine for the centuries to come. So instead of jabbing a needle into your belly this month, try cooking with your family a few times, and we'll see you when you're 100.
It seems like these myths have to be debunked every single week. Yes, we already know that most people that take these medicines will have to continue taking these medicines in order to keep the weight off. We have data up to now 4 years showing that people keep the weight off once they lose it, as long as they keep taking the medicine. Now, there are about 10 to 20% of people who are re-randomized to placebo in these randomized controlled trials that do keep off the weight. I look forward to seeing longer-term studies showing just how many people can keep off the weight when stopping these medicines. He does mention that the medicines deaden your appetite, which is the mechanism by which people lose weight by eating fewer calories. However, then he mentions that it deadens other things in your life, like your sex life. There isn't much about this reported in the literature. However, we do see this anecdotally. And again, this comes down to having that risk-reward decision-making process between the doctor and their patient to go over the potential risks of these medicines. However, I will say that it's mostly minimal that I see it. I have surveyed my patients and followers, and it seems to be the minority of people that get libido issues from taking these medicines. There's also an improvement in things like craving for alcohol and other reward-like risky behavior. So that's something to consider too. Something that he gets absolutely wrong and shows that he doesn't have much experience with these medicines is that he says it gives permission for people to go through the drive-through to eat whatever they want. No, the medicines help people not want to go through the drive-through. That's the whole point. It quiets the food noise, improves the satiety, and helps people do the things they already know they need to do, which is like things like cook at home, like what he's saying. If cooking at home were the answer, then of course everybody would do it and we wouldn't have obesity in the first place, because everybody already knows to cook whole foods, things like eating broccoli instead of French fries and other highly palatable, high-calorie foods. Imagine if a patient came to my office and asked me, "Hey, Dr. Nadolsky, can you help me lose weight?" And I said, "Have you ever thought about just like cooking whole foods at home?" And they look at me strangely like, "What are you talking about? I've been trying to do that forever," or whatever barrier has been stopping them. But mostly it's a dysregulated appetite, and that's what these medicines help with. So Dan, I appreciate that you're trying to get people to do healthy habits. We all know that eating whole foods, cooking at home is a good thing, but you got to find ways to help people do that. And sometimes that requires taking a medicine to help with the dysregulated appetite in the brain.